Hi, I'm Tom Buchholz. I'm a radiation oncologist who practices at Scripps MD Anderson Cancer Center in San Diego. I'm also the medical director of Scripps MD Anderson Cancer Program. The usual treatment of radiation occurs after a surgical procedure, and it's pretty uncommon to use radiation preoperatively outside the context of a clinical trial protocol. The one exception, of course, would be the rare circumstance these days in which the patient presents with locally advanced breast cancer, undergoes neoadjuvant systemic treatments with chemotherapy and/or combinations of chemotherapy and anti-HER2 treatments, and then really fails to respond or actually progresses during the course of neoadjuvant chemo. As I mentioned, this is a pretty unusual or exceedingly unusual circumstance, but if you have a busy breast cancer center, occasionally you could see this. If the surgeon, after neoadjuvant systemic treatments, doesn't think they could do a mastectomy or doesn't think they could do a primary closure and doesn't have a plastic surgeon who could bring in a flap to close the mastectomy, then that would be the clear indication when you could use radiation preoperatively, or some combinations, even a preoperative chemoradiation at sometimes with either a platinum or Xeloda combination. I mentioned that's a pretty uncommon scenario that's required. In those instances, preoperative radiation has to be given at relatively high doses, and the complications for subsequent mastectomy, wound complications, are relatively high. So again, we don't do that very commonly. However, I think there are some new avenues to look at preoperative radiation. We've been doing some studies at MD Anderson looking at doing a tumor bed boost and seeing if it imparts an immunogenic response for some patients in an effort to at least do some translational research to determine if the use of radiation preoperatively in combination with subsequent immuno-oncology agents will actually be a favorable inducer of tumor antigen expression that could lead to better responsiveness to immuno-oncology agents. Those agents to date are still on the basis of clinical trial for non-metastatic breast cancer, however. The other thing that's being explored is for people who want to undergo mastectomy and immediate breast reconstruction. Sometimes the sequencing of reconstruction and radiation is challenging in the setting of post-mastectomy radiation. And so again, on clinical trials, some investigators are trying to determine whether this can be overcome by doing preoperative radiation with a relatively short interval to then proceeding with a skin-sparing mastectomy and an immediate reconstruction. And it's a novel approach, but I don't think we have sufficient data yet to recommend that in any way off clinical studies.